Ulcerative colitis is an inflammatory bowel disease that is characterized by recurring episodes of inflammation limited to the mucosal layer of the colon. It commonly involves the rectum but may extend to involve other parts of the colon. Age of onset is usually between ages 15 and 30. Risk factors are genetic susceptibility, increased dietary fat and polyunsaturated fatty acids. Stress may have a role in the exacerbation of symptoms. Symptoms are diarrhea, which may be associated with blood, fever and fatigue. Extraintestinal manifestations, conditions outside the gastrointestinal tract, are arthritis, the most frequent extraintestinal manifestation, eye disease, skin disease, primary sclerosing cholangitis, a complicated chronic liver disease. Diagnosis is based on symptoms. Markers of inflammation, blood C-reactive protein and fecal calprotectin. Endoscopy and biopsy. Abdominal imaging is not required for the diagnosis. With treatment, the course of ulcerative colitis typically consists of intermittent exacerbations alternating with periods of remission. The disease can be limited to the rectum, proctitis, or can be more extensive. Proctitis usually has a more benign disease course. Treatment is usually mesalamine, pentasa, and glucocorticoids. More severe cases may need anti-TNF therapy such as infliximab, Remicade, adalimumab, Humira, or golimumab, Simponi. Immunomodulators such as azathioprine, Imuran. Anti-integrin therapy, vedolizumab, Entyvio. Anti-interleukin 12/23 therapy, ustekinumab, Stelara. JAK inhibitors such as tofacitinib, Xeljanz, upadacitinib, Rinvoq. S1P receptor modulator such as ozanimod, Zeposia. Fecal transplants may become a future treatment for refractory disease. The procedure involves inserting stool from a donor into a recipient's gastrointestinal tract. Surgery is required when patients fail medical therapy or when serious complications arise. There is an increased risk for colon cancer. The extent of colitis and the duration of the disease are the two most important risk factors, which means that patients with proctitis are probably not at increased risk, but patients with pancolitis have a high risk. The risk begins to increase about 10 years after the onset of the disease. Want to know more? Watch my channel.